Chapter 16, Pediatric Radiography. In this PowerPoint presentation, you'll notice that I did not include a lot of images due to a lot of repeat learning throughout all of these chapters, and some of which of the pathology I was not able to find images for you that were pediatric. If you have questions, let me know. You can start looking at slides 43 through 119. That's going to be review on all of the items that you use with pediatric imaging. People such as parents and other people that work around you, what their roles in pediatric imaging would be. If you have questions about any of that, please let me know and I will help you through it. Aspiration. Most common in small children when foreign objects are swallowed or aspirated into the air passages of the bronchial tree. Most common in right bronchus due to the bronchus size and angle of divergence. Radiographic exams include an AP and lateral chest, as well as an AP and lateral upper airway. Asthma. Common in children and generally caused by anxiety or allergies. May not be seen on chest x-rays unless there is an increased mucus amount causing labored breathing. Radiographic exams include a PA and lateral chest. Croup, commonly seen in children ages 1 to 3 years old. Caused by a viral infection, causes labored breathing, dry cough, and sometimes fever. Smooth but tapered or a steeple sign appearance in the upper airway. Do a PA and lateral chest as well as an AP and lateral airway. Cystic fibrosis, inherited disease, secretions of heavy mucus cause progressive clogging of bronchi or bronchioles. Radiographic appearance of increased radiodensities in specific lung regions, hyperinflation in the lungs, or blocked airways may not be symptomatic at birth but may develop later. Radiographic exams include a PA and lateral chest. Epiglottitis, supraglottitis, common in children 2 to 5 years old, bacterial infection of the epiglottis, serious condition that can be fatal if left untreated, blockage of the airway. Radiographic exams include an AP and lateral chest and lateral upper airway. Hyaline membrane disease, respiratory distress syndrome, common indications for chest x-ray in infants, emergency condition where alveoli and capillaries of the lungs are injured or infected, causing leakage of fluid and blood into the spaces between the alveoli or into the alveoli. Appear as increased density in a granular pattern radiographically. PA and lateral chest are your radiographic exams. Meconium aspiration syndrome, inhalation of meconium stools in the lungs during the birth process, may result in blocked airways, causing air sacs to collapse, creating possibility of lung rupture, a pneumothorax, or atelectasis. Radiographic exams include an AP and lateral chest for possible pneumo. Craniostenosis, deformity of the skull caused by premature closure of skull sutures. Most commonly involves the sagittal suture and results in AP elongation of the skull. Radiographic exams include an AP and lateral skull. Developmental dysplasia of the hip. Femoral head separated by the acetabulum in the newborn, most common in girls. Infants born breech, infants with close relatives with the same disorder. Exams include sonography or ultrasound and an AP hip. Idiopathic juvenile osteoporosis. Bone becomes less dense and more fragile in children and young adults. Requires a slight decrease in exposure factors. You're going to do a bone survey study, an AP of bilateral upper and lower limbs. Osteochondrodysplasia. It's a group of hereditary disorders in which the bones grow abnormally, dwarfism or short stature. Achondroplasia, most common form of short-limbed dwarfism, decreased bone formation in the growth plates of long bones. You're going to perform a bone survey study of the long bones. Osteochondrosis affects epiphyseal and growth plates of long bones, pain, deformity, abnormal bone growth. Kohler's bone disease, inflammation of bone and cartilage of the navicular bone of the foot, more common in boys ages 3 to 5. Leg calf Perthes disease, abnormal bone growth at the hip, head and neck of the femur. Affects children 5 to 10 years old, typically affects one hip and more common in boys. Femoral head appears flattened and then later appears fragmented. Osteochondrosis, Osgood-Schlatter disease, causes inflammation of tibial tuberosity, the tendon attachment. Common in 5 to 10-year-old boys, typically affects only one leg. Schumerman's disease, common condition in which bone development changes of the vertebra result in kyphosis, more common in boys beginning in early adolescence. Radiographic exams for osteochondrosis, AP and possible oblique, and lateral projections of affected limbs. For the Kohlers, it would be the navicular on the foot. For leg calf Perthes, it would be the hip. Osgood-Schlatter would be the proximal tibia. And for Schuman's, it would be the spine. Osteogenesis imperfecta, hereditary. Bones are abnormally soft and fragile. Infants with this condition may be born with many fractures, which may cause deformity or dwarfism or both. Skull sutures are unusually wide, with many small Wormian bones. Requires a significant decrease in exposure factors up to 50%. Radiographic exams would be a bone survey to include an AP and lateral skull. Infantile osteomalacia. Rickets. Developing bones do not harden or calcify, causing skeletal deformities. Common deformity is bowed legs. Requires a moderate decrease in exposure factors depending on severity and age. Radiographic exams are an AP lower limb. Salter-Harris fractures. Fractures involving the epiphyseal plates, classified based on location of fracture and involvement of surrounding anatomy. 9 classifications, but 1 through 5 are most common. Type 1 is a transverse fracture along the epiphyseal plate. Type 2 is a fracture through the metaphysis and the epiphyseal plate. Type 3, fracture through the epiphyseal plate and the epiphysis. Type 4 is a fracture through the metaphysis and epiphyseal plate and the epiphysis. Type 5 is compression fracture of epiphyseal plate. Radiographic exams in AP, possible oblique, and lateral of affected limbs. Those were really hard slides to get through. Spina bifida. Posterior aspects of the vertebrae fail to develop. Exposes part of the spinal cord. Meningocele. Common and severe form of spina bifida. Protrusions of the meninges through the undeveloped opening of the vertebra. Myelomeningocele is a most severe type. Meninges and spinal cord protrude through the opening, most severe in cervical region, causing major physical handicaps, deterioration of kidney function, and hydrocephalus. Spina bifida occulta, mild form, some defect or splitting of the posterior arch of the L5S1 without protrusion of the spinal cord or meninges. Radiographic exams include a prenatal ultrasound, PA lateral spine, CT, or MRI of affected region. Talipes, I think is how it's pronounced. Otherwise known as club foot, congenital deformity of the foot, diagnosed prenatally with real-time ultrasound. Radiographic exams, AP and lateral foot, the kite method. Atrasias, clausura, congenital condition, requires surgery due to an opening to an organ being absent. Can be biliary, esophageal, duodenal, mitral, tricuspid, anal. Radiographic exams are AP, abdomen, and a GI series. Hematuria, blood in the urine, can be caused by various conditions. Cancer of kidney or bladder, kidney stones, kidney cyst, or sickle cell disease. You're going to view that on an ultrasound. Hirschsprung's disease, congenital megacolon. Nerves that control rhythmic contractions are missing, causing severe constipation or vomiting, corrected surgically by creating colostomy. You need an AP abdomen and a GI series for your exams. Intestinal obstruction, blockage of the intestine, most common in infants and due to birth defects. Ileus, paralytic ileus, adynamic ileus, caused by lack of contractile movement of the intestinal wall. Intussusception is telescoping of a loop of intestine into another loop, most common in distal small bowel. Meconium ileus, mechanical obstruction. Intestinal contents become hardened, creating blockage, conjunction with cystic fibrosis. A volvulus, mechanical obstruction, twisting of the intestine itself. X-rays are going to include an acute abdomen series and a small bowel series or barium enema. Necrotizing enterocolitis. Inflammation of the inner lining of the intestine caused by injury or inflammation occurs commonly in premature newborns. May lead to tissue death of part of the intestine, confirmed radiographically by presence of gas introduced by bacteria inside the intestinal wall. You're going to have an acute abdominal series performed. Polycystic kidney disease, inherited renal condition, multiple cysts form in kidneys, causing enlarged kidneys in infants and children, can be fatal without dialysis or kidney transplants if both kidneys are affected. Radiographic exams include sonography, CT, and MRI. Pyelonephritis, bacterial infection of the kidneys, most commonly associated with or is caused by vesicoureteral reflux of urine from the bladder back into the kidneys. Radiographic exams is a sonogram. Hypertrophic pyloric stenosis, overgrowth in the muscles of the pylorus causing narrowing or blockage at the pylorus or stomach outlet. Occurs in infants and typically causes repeated forceful vomiting. Radiographic exams would be an upper GI series and a sonogram. Tumors. Malignant tumors occur less frequently in children than in adults and are more curable in children. Neuroblastoma, childhood cancer, age younger than 5 years old. Tumors occur in the nervous system, typically adrenal glands, and usually in one kidney. Wilms tumor, cancer of the kidney or embryonal region, typically occurs in children younger than 5 years old, most common cancer in infants or children, typically involving one kidney. Radiographic exams include radiographic studies of the affected body part, CT, sonography. Urinary tract infection, caused by bacteria, viruses, fungi, or some type of parasite. Bacterial infections in newborns involving the bladder and urethra, most common in boys until 1 year old, then more common in girls. Common cause is vesicoureteral reflux. Your radiographic exams include a VCUG. Vesicoureteral reflux causes backward flow of urine from the bladder into the ureters and kidneys, increasing chance of spreading infection from the urethra and bladder into the kidneys. Radiographic exams include a VCUG and nuclear medicine.